Lymphoma is basically the malignant transformation of the lymphoid cells, primarily in the lymph node. So lymphoma is classically divided into the two types, non-Hodgkin lymphoma and Hodgkin lymphoma. So this non-Hodgkin lymphoma is further divided into the two types, B cell non-Hodgkin lymphoma and T cell non-Hodgkin lymphoma. So this B cell non-Hodgkin lymphoma is further divided into the four subtypes. Follicular lymphomas. The follicular lymphoma follow the indolent course, and it is a painless waxing and waning adenopathy. So it is a painless waxing and waning adenopathy cured with chemo. It's cured with radiation therapy. Next is a diffuse large B cell lymphoma. So it is a intermediate grade. So it is a intermediate grade, and it is a most common non-Hodgkin lymphoma. Most common non-Hodgkin lymphoma in adult. So it is a most common non-Hodgkin lymphoma in adult, present with single large rapidly growing mass. Single large rapidly growing mass. So it is a cure with R-CHOP therapy. We will discuss this therapy in detail. So next is a Burkitt lymphoma, that is a very high yield. So Burkitt lymphoma is basically high grade lymphoma. So it is a high grade. Next is, it is a on biopsy, it is a starry sky appearance. So starry sky appearance on biopsy. Jaw lesion. Jaw lesion in African people. While abdominal lesion in American. In American, it is abdominal lesion. Abdominal. Okay. So it is highly associated with Epstein-Barr virus. So it is highly associated with Epstein-Barr virus. So translocation will be T814 in this Burkitt lymphoma, and aggressive treatment, it need aggressive treatment with chemotherapy. So the last one is a mantle cell lymphoma, that is the rarest form of non-Hodgkin lymphoma. So it is a rarest form of non-Hodgkin lymphoma. Next is CD5 plus positive. So it is a CD5 plus positive cells. So now we're going to discuss about the T cell non-Hodgkin lymphoma. So T cell non-Hodgkin lymphoma is divided into the two types, adult T cell lymphoma and mycosis fungoides. So adult T C lymphoma is basically present with cutaneous lesion. So it present with the cutaneous lesion. It may convert into acute lymphocytic leukemia, AL. So it is highly associated with HTLV and IV drug abusers. Next is a mycosis fungoides. So mycosis fungoides is basically the T cell lymphoma of the skin. So it is a T cell lymphoma of the skin. So it is a T cell lymphoma of skin. So again, it is a present like eczema-like eczema-like lesion and pruritus. So eczema-like lesion and pruritus, itching is a common presentation. So on skin biopsy, we see cerebriform lymphoid cell, cerebriform lymphoid cells. It may convert into T cell leukemia. When it is convert into the T cell leukemia, it is labeled as very high yield Sézary syndrome. So it is labeled as Sézary syndrome. So now I'm going to highlight some key differences between the Hodgkin and non-Hodgkin lymphoma. So non-Hodgkin lymphoma, many nodes are involved, extranodal and non-contiguous spread. While in case of the Hodgkin lymphoma, single group of the localized node involved contiguous and rarely involve the extranodal sites. So mainly the B cells and the Reed-Sternberg cells. The exam may show you the picture of this Reed-Sternberg cell that are distinct CD15 plus and CD13 B cells. So peak incidence of non-Hodgkin lymphoma is 65 to 75 rare, while in case of the Hodgkin lymphoma, it's a bimodal presentation. In case of 30, in case of the 30, it will be nodular sclerosing type. It is a nodular sclerosing type. While in case of, if it is the age of the patient is 60, typically in 60s, it will be lymphocyte depleted. So it will be lymphocyte depleted type of the non-Hodgkin lymphoma. And it is highly associated with Epstein-Barr virus. And while the non-Hodgkin lymphoma is highly associated with HIV and autoimmune disease, autoimmune association. So one another thing that the treatment of non-Hodgkin lymphoma is according to the stage, while the non-Hodgkin lymphoma treat is according to histopathology. So histopathology. So lymphoma typically present with adenopathy, right? So adenopathy. So Hodgkin lymphoma is present with cervical adenopathy, cervical adenopathy, and if it infradiaphragmatic involvement, so it's a typically above the diaphragm. So if it is an infradiaphragm, it mean the disseminated disease. So infradiaphragmatic disease in case of in case of the Hodgkin lymphoma mean disseminated disease. So the B symptoms, what are the B symptoms? So B symptom is basically the fever and night sweats. So fever and night sweats are a B symptoms. Again, B symptoms, fever and night sweats. So they present in both type of the lymphoma, non-Hodgkin and Hodgkin lymphoma. So another important difference, but that is a rare but very specific, rare and specific to Hodgkin lymphoma is pale abstin, pale abstin fever, pale abstin fever, and alcohol induced nodal site pain. So alcohol induced nodal site pain. So what is a pale abstin fever? Basically, it is a 1 to 2 weeks of high fever. Then it's alternate with afebrile phase, right? So what are diagnostic investigation for the lymphoma is a excisional lymph node biopsy. So excisional lymph node biopsy is a best initial investigation for the diagnosis of the lymphoma.